okay, parents, your kids are going to turn out just fine.
This episode of the podcast is brought to you by FOCO. That's FOCO, F-O-C-O. If you are a parent of a child or teen with ADHD, you know how challenging it can be to keep them focused and engaged. FOCO is the all-natural solution for ADHD, whether it's for school, homework, or just everyday activities. FOCO helps your child or teen stay calm and attentive. Before trying prescription drugs like Adderall that can come with harsh side effects, I recommend you try FOCO. Visit ThinkFOCO, that's ThinkFOCO, thinkfoco.com for more information. Welcome to the Your Kids Will Be Fine podcast. This is Dr. Michael Malowski, board-certified pediatrician and parent of 7. Your Kids Will Be Fine podcast is all about helping parents sort through the information overload and help to simplify some of our parenting decisions and hopefully decrease our parenting anxiety around a lot of these decisions that we are faced with, especially in young children, and help you maybe feel better that your kids will be fine. Today is our second part of our 2-part series on infancy, kids about 2 to 12 months. Last podcast, we talked about food introduction. I think we talked about sleep training and the most important things you need to know about development and developmental milestones. So this session, we're going to talk about a topic that I think there's a lot of misinformation and perhaps a glut of information that makes it hard to really sift through, and that is head shape and helmets. So let's talk about how pediatricians think about assessing and understanding concerns about head shape, who they refer to, and what are the treatment paths depending on the specifics. So usually in the 2-month and 4-month visit, if your child is developing a head shape issue, is when most pediatric visits will be able to diagnose and catch it and advise you on what the issue is. Some head shape issues present earlier. However, most of those are what we call are more concerning for a pathologic condition called craniosynostosis. Craniosynostosis is really what we're trying to differentiate from what we call positional plagiocephaly. Positional plagiocephaly is just the normal deformity of the head based on the preferred position of your head and weight against the back of your head in an asymmetric way, versus craniosynostosis, which is a premature fusion of one of the skull sutures in your baby's head, which will create a very abnormal head shape as your baby's head grows, because your baby's head will not grow in the plane of where the suture is prematurely fused. Those sutures are supposed to stay open and be able to be even palpated or appreciated almost through age 2, at least through age 15 to 18 months. So kids who present with abnormal head shape in the first 2 and 4 weeks, those need to be assessed more aggressively for this pathologic condition. How is that done? Either referral to a specialist. At our children's hospital, we have a craniofacial team, which consists of facial plastics and neurosurgery who assess those kids. And the tool that we most often use to rule in or rule out this condition is a skull CAT scan. MRI is really not the ideal test to rule out this condition, synostosis. So that's a separate condition, but we're talking about the much more common situation of you go to your pediatric primary care visit at 2 months or 4 months, and you notice that your child's head is flattening, usually on one side, and their ears may be a little asymmetric. So your pediatrician usually will look at the top of your baby's head like bird's eye view, and then depending on the overall picture as well as risk factors, there's a couple of different steps to take. So usually this is found between 2 and 4 months. We look at one, was your child premature? And with prematurity becomes they're a little bit weaker. Their neuromuscular development can be lagging behind because of prematurity, and they're at higher risk for having worsening of this condition more rapidly, versus a normal, healthy, full-term baby that has a little bit of a head tilt, maybe because of the way they were positioned in utero, and that's causing some preferential positioning of their head, especially because we put kids to sleep on their back. And then based on those factors, we decide on where to send your baby. Most of the time, in mild to moderate cases, and even in moderate to severe cases, the first intervention, which we try to initiate before 4 months of age, is a round of physical therapy with a pediatric physical therapy team that specializes and understands the specific needs of kids with this condition. And they often will assess your baby's head shape. They'll run some measurements and metrics, and they also send you home with daily exercises that they show you and then close follow-up. Most kids are starting to respond and showing significant measurable and visual changes between 4 and 6 months. And if so, physical therapy is usually the answer. If you get to between 4 and 6 months and it's felt that either we didn't pick it up or it wasn't obvious until a little later, or that your child's head shape doesn't seem to be responding to physical therapy and conservative measures, that's when the discussion about helmet and helmet therapy comes in. There has definitely been a lot more interest from my families, and I think people in general, about helmeting because of social media and because people will advocate for it as the first intervention or perhaps the first thing to do. You see lots of influencers and celebrities who have kids and their kids have helmets because of head shape. And the issue with that really is that the evidence around, and we're going to talk from mild to moderate plagiocephaly, the evidence for differences in long-term outcome is pretty thin, in that it really seems from most of the studies on this that healthy kids without any other risk factors who don't have an underlying condition, who are treated with conservative measures like physical therapy or helmets, have about the same long-term outcome, which is, how's your head look when you're 3, 4, and 5 years old. And so it's a huge expense. Your insurance may not cover it. And the outcome difference for most kids doesn't seem to really be measurable enough to warrant putting your child through or paying for helmeting. So the bottom line is that if you're concerned about it, bring it up early. Talk to your pediatrician about it at the 1 month, 2 month, and 4 month visits. Physical therapy is usually the first stop for most families. And helmeting is usually not necessary, or if it is usually if conservative measures like physical therapy aren't working, or your child has an underlying condition that would make them at higher risk for a much worse outcome, therefore helmeting would be appropriate. So I think that's considered the most rational approach without going overboard. So the other topic we're going to explore today is sick kids. And I think that we talked about in the episodes about newborns, how newborns with fevers and illnesses are a very different situation. But now we're talking about illness and fever in your infant who is no longer a newborn. So we're going to start the discussion at kids around 4 months of age, because that's really considered the age where you're really completely out of this high risk category, where fever needs to be more urgently assessed just based on fever. And once you're at 4 months, most kids have had at least 2 sets of their routine vaccinations. Their immune system is a little more mature, and kids are a lot more engaging and developmentally more awake and active. And so you can actually make more of an assessment on their well-being by looking at them. So by far, fever is the most common presentation of most illnesses, for most viral illnesses, and usually fever combined with other symptoms. And almost invariably, it happens after your office is closed, and you are generally forced to describing your symptoms. You're forced to have to describe your symptoms to a provider or a nurse call service on the phone. So it's good to have in your pocket some ideas of when to be worried and when to be most concerned. It's always a good idea to call your primary care pediatrician's after-hours call line and ask questions and make sure that you're thinking about it the right way. But generally, in a child who's 4 months of age and older, who has a fever, the fever alone is definitely not an emergency at the same way it was when your child was 2 weeks, 1 month, 2 months old. And the reason why is that they're much more robust, their immune system is more mature, like we said, and they've been vaccinated a couple times. So you can, as a parent, look at your child and think about how worried should I be based on their general appearance, meaning they're having fever, but are they looking at you? Are they engaging? Or are they interacting with you in the way that you're used to seeing? Are they having any trouble breathing or respiratory difficulty with that fever? Are they able to tolerate fluids and hold them down and not vomit everything up? If the answer to all those are yes, it's perfectly reasonable, if you want, to call your provider and make sure, and to treat that fever with medicine to bring the fever down, and observe your child at home until the next opportunity to have them brought in to see your doctor during regular office hours. So treating your baby with Tylenol if your child is under 6 months. If your child is 6 months or over, you can choose either Tylenol or ibuprofen, which is dosed based on weight, which will usually be provided to you by your pediatric provider about proper dosing. And then you give the fever medicine and observe your child. Generally, for most viral illnesses that are not concerning, that come with a fever, when you do something to bring the fever down, like treat with Tylenol or ibuprofen, your child will simply look better, more active, more alert, happier, just from that intervention, along with the fact that we've already talked about is not having trouble breathing and is able to tolerate and drink fluids, then you know that you're perfectly okay observing your child at home without bringing your child to an emergency room or an urgent care and being seen the next office day during routine office hours. There are still certain concerning bacterial infections that also present with fever that we have to worry about. In order that with prevalence in young children up to 12 months, they are: one, urinary tract infection, by far the most common non-viral bacterial infection that presents with fever, as well as pneumonia, and then further down the list are things like meningitis or bacteremia, which is bacteria in the bloodstream. Skin and soft tissue infections. However, in most of those cases, your child will look profoundly unwell, meaning will not improve or look better just by bringing the fever down with medicine. Will have some other symptoms like throwing up or respiratory changes or difficulty, especially with pneumonia. With UTI, fever can be the only symptom. And however, if your child has fever with viral symptoms, UTI is a lot less likely. And once again, your child will likely look unwell in some other way. So this is why talking to your primary care pediatric after-hours providers is a good way to help troubleshoot and figure out what you should do. But as a general guideline, what I just gave you is a really good framework to help parents feel less stressed about what to do when your child has a fever, especially after hours and nights and weekends when your pediatric office is usually closed. And most fevers don't require an emergency room visit just because of the fever. So I hope this helps. And we are looking forward to our next series where we're going to talk about toddlers, everyone's favorite topic. Kids 1, 2, 3 years old. And we look forward to have you guys checking us out at yourkidswillbefine.com. You can find Your Kids Will Be Fine podcast everywhere you get podcasts, including Apple and Spotify. And don't forget to you can find our video and podcast on our YouTube channel. Love to hear from you, hear your comments and suggestions for further and future show ideas. And everyone have a great rest of your weekend.